Welcome to MedAxiom HeartTalk, where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
Welcome to MedAxiom HeartTalk, and we have been talking a lot lately about artificial intelligence, so we are going to move in that direction with this conversation as well, talking about AI and how to identify and improve outcomes for our cardiovascular patients. So joining us today, we have Dr. Ben Peterson. Thank you for joining us, an interventional cardiologist, Medical Director, Heart and Vascular Research Institute at St. Elizabeth Healthcare System. So we appreciate you talking with us today.
Sure, happy to be here.
All right, so you also use one of our partners, Ignite, to implement AI solutions. So we'll delve into that and how that really is helpful and almost essential these days. So what challenges or gaps in cardiovascular patient care made you realize that there definitely was a need for a better solution?
Sure, well, there's such complexity in cardiovascular medicine in the 21st century. And if you take a step back and think fundamentally about medicine, for hundreds of years, when the patient comes to us, we are taking what they present to us. I'm here with this concern, or I'm here with that concern. But a patient with cardiovascular disease may have 10 or more problems. And many of the things that they come to us with while pressing may not even be their most concerning problem on the one hand. But also, if you look at the population that we're taking care of, what we are dealing with as a system may not actually represent the burden of disease in our community. And so there's actually these two very large gaps where Ignite helps us think about one of these, which is aortic stenosis. And across the country, 60% or more of patients with severe aortic stenosis or failure of the aortic valve actually do not receive treatment.
Wow.
And it's often because the valve itself is insidiously progressing. The symptoms may be subtle. The patient may come in with different complaints, or the finding may not jump out and grab the physician's attention among all the many things that they're taking care of. And so this is just one small example of something where alerting physicians of a serious and deadly, but not that noisy problem can really improve individual patient care, but also system-wide patient care.
So how does Ignite help you to execute that?
Ignite uses artificial intelligence to read behind the medical chart. It actually reads our entire medical record, and it uses the words that were placed in there, or natural language processing, to identify patients who have failing aortic valves. In this particular case. And so it's looking across the spectrum of cardiovascular disease, and it's finding just within the language of the chart discrete fields and words that describe problems. But then it adds to that some nuance where it has algorithms where it shows which patients are likely to actually be symptomatic from this. Because many times a patient may come to us and say, I feel fine, but they've actually been in the ER twice with shortness of breath. The AI can help identify patients who are more symptomatic based off of presentation. And of course, it's not perfect, and the human intelligence or the emotional intelligence factor of actually meeting the patient where they are and figuring out what's wrong with them and helping them to understand the seriousness of the problem when they may be coming in for something else. That all is complicated, and the AI doesn't answer all of those questions.
We need you for that, for sure. Can you describe a patient who was found by this technology that otherwise could have potentially been lost?
Yes, absolutely. We, in our healthcare system, had an 82-year-old woman, very spunky, very spry, still working in her garden, and she had several fairly demanding problems. She had complex coronary disease, and she also had severe vascular disease, and various different providers were involved in these things, and her echocardiograms were being read out with some degree of aortic valve failure. But because of all these pressing things that she was coming to our medical system for, the aortic valve was never being addressed, and she had stents done in her coronaries and still actually didn't feel better and was still getting shorter breath, even weeding after a few flowers. She really couldn't do what she was trying to do in her garden. And we identified her aortic valve failure through this, and we reached out to her cardiologist, who very willingly sent her over to the valve center, and we placed her valve last Thursday.
Wow.
And she woke up from her procedure saying, I can finally breathe.
Oh, that's
And so time will tell how she recovers from this, and I really hope to hear of her petunias and her daffodils next spring, as she's working on that.
And I love that you using AI, but still know her. You know the patient, you know what she's into, and that also allows you to say that she has the ability to do more and be better.
Absolutely. Artificial intelligence cannot replace emotional intelligence.
So what are some of the challenges that you face when integrating AI technology into patient care workflows?
I think AI can be a scary term sometimes, and sometimes it's helpful to be a little bit more specific about what we're talking about. Are we using some kind of scary black box that's going to replace us? Or are we saying we're using natural language processing, us as a tool, are using natural language processing to read through our own medical record and better understand what's in there? Or are we using generative AI to understand our own images better and pick up on findings that may have been missed? Or are we using complex modeling and predictive scores to think about what may happen in the future with patients? I think that there are legitimate concerns of saying, well, we're going to replace our thinking. And I think that is what we as physicians value above all else, is our ability to think and discern and figure out what is happening to our patients.
I think for patients too, they want that piece. I think when I think about being a patient or caring for my mom, we want it all, right? And we know that we can't have that.
I mean, you could make it an analogy where physicians who years ago would have relied a lot more on their stethoscope to find certain findings, and physicians of a certain generation are just very, very astute at physical exam findings, and there is nothing to be lost of having that level of skill if the patient also can get a CT scan or a thoughtful imaging that doesn't supplant the ability to actually have excellent listening skills with your stethoscope still. And you could make this comparison with AI, where your diagnostic skills, your ability to connect with the patient and thinking about these things on a system level still matter very much, but it's an additional tool to help us identify things that we're just not thinking about in blind spots, or very cool ways of predicting things that may actually happen in the future to the patient, which we have never had the ability to do in the past.
Yeah, it's a huge benefit. Let's talk about the next, we say 5 to 10 years, but I feel like at this point we're like next 5 to 10 months, but what do you see as the future of AI and how this will be integrated into healthcare?
Well, that is a big question, and I think that really approximately the fall of 2022 was a Gutenberg moment. And I don't know that anyone actually knows what this means in terms of how this affects our ability to utilize these tools and move them into day-to-day practice. But I do think, if I could come up with a perfect thing, I think that there would be a system-wide tool that could, or a series of system-wide tools that can help us identify gaps in care. And I don't mean just in cardiovascular care, but what about in OBGYN or in primary care or screenings or reaching out to communities, but then also in an individualized one where there may be a dashboard. It could even be patient-facing and say, our data suggests that you may be at risk of X, or our language processing has picked up on a aortic aneurysm of a certain size, and this needs to be addressed. And that could come to our attention on some kind of magical dashboard where we could say, your next patient at 10:20 is here, and this is what our tool thinks may be worth addressing during this visit. That doesn't change the fact that I'm going to say, hello, how are you feeling today, before we jump into something like that. But I think that it could tremendously change the way that we even approach medicine. I don't think that there's a way back.
Yeah, I love that. I can definitely picture that screen with all that information. Is there anything that you know of that you're super excited about as far as integrating AI into what
Yes,
you're doing?
you know, there's another tool that I really would love to get my hands on. As a clinical research director, sometimes we are trying to enroll patients in clinical trials that may have very strict inclusion and exclusion criteria. And even now, we are nurse coordinators and the team, when a patient's brought to their attention, they have a piece of paper and they're checking boxes of do they meet this inclusion or that exclusion, or they're
Right.
going through an online form of that. But why couldn't you customize within your EMR? Here's 20 patients right now in your system that have been seen within a month that qualify for this clinical trial. And couldn't you then offer that study to them using that? I know there's tools that are designing capability like that, but to me that's very exciting to be able to move innovation and research to a whole new level where you're, instead of looking for a needle in a haystack, the needle in the haystack is being brought to you.
Right, to you, yeah.
And I think that that could really accelerate innovation and research within medicine. And I think that that could be a game changer to the point where clinical trials are done in half the speed or less, and possibly in a lot less cost, and that new drugs and innovations could reach our patients a lot faster in a much safer way.
That is exciting, definitely. Dr. Peterson, thank you so much for talking with us about how you're using Ignite and also looking towards the future. Thank you.
You're very welcome. It's great to be here.